Yeah, so golcadomide is yet another molecule that follows in a long tradition of being difficult to pronounce, which explains the rumbling over it. It is the fifth in a series of molecules developed by Celgene that's a CELMoD. This one is sort of in the tradition of thalidomide, lenalidomide, pomalidomide, CC220 for those of you who are familiar with the development chain. This drug was specifically developed in order to increase binding affinity for Ikaros and ALOS, which are specifically identified in the apoptotic cascade and predicted to be more beneficial in patients who have lymphoma. So this was a phase 1 study looking at incorporating this drug, golcadomide, and finding out the dose to be given in conjunction with R-CHOP in patients with newly diagnosed large cell lymphoma that were considered high risk. So there were a variety of patients that were included. The majority were IPI of 3 to 5. We observed high rates of complete molecular remission across all subsets of disease and across dose levels, and it looks like probably the 0.4 milligram dose, either given on a 7-day schedule or a 10-day schedule, will likely move forward based upon those data. The toxicities were largely commensurate with what we would expect for the combination, with cytopenias being the most common. So the hematologic AEs with a bit more thrombocytopenia than we would see with the R-CHOP combination. There was some venous thromboembolic disease, and so as this molecule moves forward, there will be mandated thromboprophylaxis in this group of patients. And so this will be subject to a large randomized phase 3 study that should open next year, which will be comparing golcadomide R-CHOP versus R-CHOP in a similar set of higher risk patients with treatment-naive diffuse large B-cell lymphoma.